You're watching the Wellness Hour, news that makes you healthier. I'm Randy Hours. Today's topic, holistic health and healing. And with us, we have a doctor of osteopathic medicine that specializes in this area of medicine. He's getting amazing results with his patients, Dr. George Ceremuga. Dr. Ceremuga, welcome to the program.
Randy, thank you very much. It's an honor to be here, as today we get to glorify God.
Okay, good.
Through holistic health and healing, empowering ourselves to the optimal health of our mind, our body, and our spirit. Can we start with a grounding exercise?
Okay.
Okay, we want to sit nice and tall.
All right.
Okay, chin slightly tucked, feet on the ground.
Okay.
And just close your eyes if it's comfortable, nice and soft.
All right.
Okay, and I call this smile, because when we smile, we relax our jaw, we're open, and we're open to change.
Okay.
And when we breathe, we calm our mind, we relax our body, renew our spirit, which is the foundation for healing. And when we love, unconditional love is the greatest healer. So let's go ahead and take a big breath in, breathe in, hold, and let it out. And that breath is for humility. Big breath in, hold, and that breath is for love as we let it out. And one more. Big breath in. And let it out, and that is for forgiveness. And as we open our eyes, Randy, we run into the arms of Jesus.
Okay.
We smile, we breathe, and we love. It's just a constant reminder.
You do this with your patients?
I do this with my patients.
At the beginning, just like
Not with all the patients, but it's part of the prescription. And it's exciting because it empowers people. It lets them own their health. And it's relaxing. If you can master the breath, then you calm your mind, you relax your body, and you renew your spirit. It's like going to the gym and exercising.
Okay.
It just takes practice. It can be done. It's like kindness. It takes practice. And we can build that. And we build kindness, and we build empathy and compassion, we build love, we build peace. So those are part of the prescriptions that we will talk about with empowerment.
Okay, good. For people that don't know your practice, like who's your typical patient or categories of patients that go to see you?
Sure. I'm blessed to work in southeast Montana, big sky country, in a little ranching and farming community, Baker, and I see cradle to grave medicine.
So is it like family practice medicine?
It is.
Okay.
But we have a nursing home, we have a clinic, we have a emergency room, and so we take care of everybody. And so it's a fulfilling practice. I work up there part-time with holistic health and healing. And the other part is to build my holistic health and healing consultative practice across the globe.
So people go to you with problems like type 2 diabetes, with heart disease, or just depression, anxiety. So you see all types of patients.
Absolutely. In primary care, we're the gatekeepers. And so we do see chronic disease, we see acute diseases, but our acute diseases, the upper respiratory infections, the sinus infections, acute anxiety or depression, and developing into our chronic diseases with obesity and hypertension and diabetes and chronic anxiety and depression. You know, most of the things that I see, Randy, 75% are preventable. And so that's what really spurred my desire for holistic health and healing, is that what we're doing in medicine is not working. What we need to do is empower people. Empowerment is self-care in action, and to get people excited about feeling fully alive. And we can do that through the 5 pillars of wellness.
Now we should mention you're a traditionally trained physician. You were in the military.
Correct. I am an osteopathic physician doing an allopathic residency, an MD residency. And so I believe we need surgeries, we need medication, but the body is so self-healing and self-regulating that we need to tap into the body's self-healing, self-regulating mechanisms. And we can do that holistically through those 5 pillars.
So you were an infantry officer in the military?
Yes, I was. I graduated from the United States Military Academy at West Point in 1984. But Randy, I wanted to be a doctor ever since I was a young boy.
Okay.
When I watched Marcus Welby, MD. And I wanted to be just like him, a family doctor. So I never lost sight of that dream. So after I completed my 5 years of duty with the military, at Fort Carson, Colorado, I attended the Ohio University College of Osteopathic Medicine. And graduating from there, I did my residency in Beaver, Pennsylvania. And then the Air Force brought us to Rapid City, South Dakota, which is where Ellsworth Air Force Base is. So I practiced there for 4 years with a love and a desire to practice frontier and rural medicine. Then I went into the public health service, working with Native Americans in South Dakota and Montana. I would say probably one of the highlights of my career was 2013 to 2015. I was working at Fort Belvoir Community Hospital as the chief of integrative holistic medicine and the clinical director for the military's inpatient substance abuse program. There I learned a lot, that we all have issues. It's not just people with drugs and alcohol problems, and that we have to own them. And that really spurred my desire to practice more holistically and develop the 5 pillars of wellness.
You believe food is medicine?
Food is medicine.
Have you seen people on medications that have been weaned off under your care?
I have. I have a patient that loved his pasta, loved his bread, he's diabetic, blood sugars in the 300s on insulin and also on some oral medications. I challenged him, encouraged him, empowered him for 1 month. Go off all the pasta, all the bread, all the gluten. He came back with blood sugars in the 150s. He had lost 10 pounds. He was still on some of his medications, but we were weaning things down. And so he was empowered. I can't do that for him, but I can encourage him on that path to wholeness, path to be fully alive.
So you were doing this in the military then? This type of medicine?
Absolutely. And the exciting thing about it is when you take people off their drugs and the alcohol, you give them good food, a lot of good water, exercise, introduce yoga, meditation, mindfulness, the integrative holistic medicine. We were proving on PET scans and functional MRIs areas of the brain lighting up, healing. And the implications of that are huge, that you can treat anxiety, depression, attention deficit, post-traumatic stress, all the behavioral health diseases that we have with holistic health and healing. And people were improving, and they didn't need all those medications. A lot of our patients were coming in numb, not able to function on heavy doses of antipsychotics, antidepressant medications. They weren't living. So with encouragement and weaning off medications and introducing holistic health and healing, they were living, and they were feeling fully alive. And it was exciting to see people from day 1 to day 28, totally different people.
Is that right? So people that were dependent on medications, like a Prozac, for example, off, and you may prescribe them a little bit at the beginning and get them back and get them off.
Most of our patients...
Tell me about that. Explain that to me a little bit.
Most of our patients were on heavy-duty antipsychotic, antidepressant medications. Most of them were weaned down.
And they will stay there forever. Like usually people that take these medications kind of stay on them?
They were being treated for their side effects from their substance abuse. So we took away the substance abuse. They're in a treatment program. So they're off their drugs and their alcohol. And so they didn't need these medications. They weren't serving the patient. They were just making them stuporous. They were making them not able to function fully in life. And cognitively, you know, in the military, you need to be sharp. You need to be ready to fulfill your mission. And so it was just such an exciting thing when the patient would say, "Hey, doc, I don't need these medications. I don't like the side effects. I don't like the way they make me feel. And so I'm not sleeping any better on these medications. I have sexual dysfunction on these medications." And so, you know, they would see that they could improve on a different path, holistic health and healing.
So you're able to do that. So you see these type of reversals all the time in your practice?
We do. It all comes whether the patient's empowered. It's a lifestyle choice. Diets don't work alone to lose weight. There's thousands of diets out there. If they did, there wouldn't be so many diets. What it is lifestyle choices. And that's integrating everything into your life. And that's drinking a lot of good water, the anti-inflammatory diet, exercising routinely, getting your sleep, and the cornerstone, the most important, the rock, the foundation, is your spiritual life. Being loving and forgiving, Randy, for yourself and others, because you can't give what you don't have.
So a belief in God, that's the leverage that makes your program a little bit different or better or more effective?
I think believing in God
Okay.
and surrendering my life to Jesus was the best thing that I ever could have done. And so I don't push isn't the right word. I believe I let my light shine.
Okay.
When you let your light shine, people say, I want what that person has. And so I have a strong faith in Jesus Christ and the healing power that he gives us. He has given us as a Christian community. God has given us the power, the authority, and the commission to heal one another. And he did that in Pentecost, and when he gave all the gifts of the Holy Spirit. And so we all have gifts and talents, and so we need to use that. And that's the mandate,
Okay.
is for us to use that. And that's a choice. Will we do that, or won't we do that? In Tobit, in Scripture, God tells us that I have commissioned you to heal me. And so that's a powerful act that we can do for one another, is to help heal one another through prayer. And God has healed and cleansed the lepers. He drives out demons in people and helps people with mental illness. He cures the sick, and he brings people back to life. And so we have that ability to use those same gifts.
So in this modern day, you combine healthy, anti-inflammatory diet, nutrition, spirituality, God, bringing God into it, Jesus,
Right.
and it's a winning formula.
It is a winning formula. When you have God on your side, he's never going to forsake you. Now, we meet people where they're at.
Okay.
Okay? Not everybody is where I'm at in my faith journey right now. And so if you're not a believer or have a different higher power, the level playing field is kindness. When you can meet people with kindness, then good things happen. And that spurs on love, compassion, and ultimately peace. Peace in the present moment.